You're watching TV9 News and I'm Prajwal D'Souza. As India is struggling to cope with the second wave of COVID-19, researchers and health authorities are trying to study the emergence of new variants in the country. Now, experts have suggested that some of the variants and mutants might be fueling the surge of the second COVID-19 wave. Since the COVID-19 pandemic began, variants and mutants have been emerging constantly. However, the current mutants and strains might not be the only ones present in the country. There are chances of emergence of new strains and mutants in the future. This brings us to an important process of mapping and tracking COVID-19. Now, due to the evolving nature of the coronavirus, constant mapping and tracking is deemed necessary by the scientific community. In a recent report in Bloomberg, William Haselstein, who currently chairs the Access Health International think tank and was a former Harvard Medical School professor, underscored the need of having a mass surveillance program. The former professor said that India has the necessary genome sequencing capabilities, but it needs a mass surveillance program. Although in January, the country set up Indian SARS-CoV-2 Genomics Consortium to fast-track genome sequencing, a report by Times of India has claimed that currently the country is only sequencing 1% of the total samples collected. Here is what Mumbai-based immunologist Dr. Sitesh Roy has to say about the importance of genome sequencing and mapping and tracking. Doctor, what is genome sequencing and why is it necessary?
Genome sequencing is the process in which the genetic makeup or the structure of a virus is studied. Genome sequencing is done for all live creatures. Humans' genome sequencing has been done for a variety of diseases and associations. In case of a virus like SARS-CoV-2, it is done to know the mutations that are occurring in the virus and how those mutations may be affecting the transmissibility of the virus or the contagiousness, if you may call it, and also the clinical picture and manifestations of the disease with regards to severity.
Does India have the capability and infrastructure to successfully map SARS-CoV-2 or COVID-19?
Yes, Prajwal, there are about 10 labs in India that are part of the Indian SARS-CoV-2 Genomic Consortium. There are labs in Hyderabad, in Delhi and other parts of the country that are capable of doing genomic sequencing and mapping. And they have been doing so since the beginning of the pandemic. Though the rate at which it is being done is not as much as it should. It is suggested that at least 5% of all the samples that are being collected should be genomically sequenced.
Doctor, why is a mass surveillance program important? How can it help health authorities?
A mass surveillance program is part of the public health approach because in COVID-19, which is a widespread disease that does not follow any borders or any rules or regulations, knowing how a specific virus is spreading, how specific variants of the virus are spreading, not just across cities and states, but also across countries, is extremely important because ultimately this virus has shown us the concept of one world, one humanity, because a virus that originates in UK can transfer to over 60 countries, a virus that originates in India can transfer to over 20 countries, and hence genomic sequencing lets us track the virus, track the disease.
Doctor, by tracking the coronavirus, can scientists predict the plausible mutations of emergence of new variants?
In my opinion, predicting emergence of new variants is not really the purpose of genomic sequencing. Genomic sequencing primarily tries to identify the changes that have occurred in the viral pool in that community or state or city or country. However, this is not something that we do as a predictive process. It is more as a uncovering the truth or a discovery process so that we know which are the variants that are making up the maximum cluster of infections and causing the maximum problems in a certain community or region of the world so that we can better delineate the lines of management.
The efforts are going on in India to curb the spread of COVID-19. However, the situation is becoming worse every day due to the reported shortage of hospital beds and oxygen. We cannot stress this enough. follow safety protocols and wear a mask as it is a necessary step to curb the spread of the coronavirus. If you like this video, do click on the like button and don't forget to subscribe to TV9 News on all the social media platforms. Thank you for watching and stay safe.